This video will demonstrate ED launch point for nurses working within an emergency department. First, we navigate to ED launch point. Here we can see all of the patients that are currently in the emergency department. Always check to make sure that you are in the correct location. If you wanted to change the location, you can click onto the Change Location button here. To do a navigation of this screen, we have the pre-arrival button where we can click to add a pre-arrival. We would document any information here that we were given over the phone, and then we would click OK. You'll note that there's an S-bar format down the bottom here. When you click OK, it would appear on ED launch point here. We have different tabs here: My Patients, All Beds, Acute Resuscitation, and you'll notice that we also have a little drop down here which allows us to select additional tabs. And if I select PAH pre-arrival, I can see the pre-arrivals here. I'll now click back to All Beds. You'll notice we also have a summary of the emergency department here, so we can see how many patients are in the waiting room, how many pre-arrivals, current patients in the last hour, for example. Next, I'm going to demonstrate how you check in as a provider. You'll click onto the menu icon here and select Check In. Your name will appear here based on your Novell username that you've logged in with. Ask locally whether you select available teams and whether you select all or none. Ask locally what the associated provider color is for your role, because this is a visual cue. So for example, if a registered nurse was green, I would select the appropriate shade of green. Once I've completed this information, the default relationship, I have registered nurse. So select your role here from the drop down and click OK. Now you're checked in, and now you can assign yourself to your patient. The color code down the side indicates the status of the patient. So if it's purple, it's pre-arrival. You'll also note that the status column matches the color column here. We can see the location of the patient. We can see their triage category. We can see the patient's name. It has their date of birth and their gender. And we can also see this icon that says whether or not the patient has allergies or alerts on file. This is the length of stay, the total length of stay. You can filter by length of stay for newest or oldest presentations. You can see that these patients that were recently triaged do not have the red because they are within the 4 hours. We've then got our treating clinicians section, and this is where you'll assign yourself to your patient. You'd click into this column and you would assign yourself as the RN. Your initials and the colour now populate here on ED launch point, and that communicates to all clinicians that you're the nurse caring for this patient. If you have a particularly busy list, such as this one here, once you've assigned yourself to a patient, you can actually click on the My Patients tab and it will filter down just to show you your own patients. We then see the information that was entered on triage. We see that vital signs have been completed for this patient because we can see the heart, and we can click on them and we can review those here. We can see that there's been no medications ordered because the medications icon is not available. We can also see there's no pathology, no ECG, no radiology, but we can see that there are patient care orders here that need to be completed. We can see that the ones above and below have a red outline, and that means that these ones are overdue. If you click, it'll tell you what the task is that needs to be completed. So the ED adult assessment needs to be completed for this patient. We also have this consult order icon as well. If you see the column here for P, that will have notifications for the physician. But for the nurse, they will have the nursing activities here with a tick, and you'll see the number of activities that need to be completed for this patient. And we can see that they're currently unassigned. This patient is currently in triage. If we want to assign them to an area, we simply click on the hyperlink of triage and we select a bed. So for example, I'm going to select acute bed 5 and click OK. My patient's now assigned to that bed. If you'd like to see a summary of the patients, you can actually click next to their name here on a blank area, and it brings out this patient's summary. It gives you a summary of this particular presentation, any allergies they have, and it also gives you a summary of the past 5 ED visits within the last year, and also the past visits to a digital hospital within the last year. Any documentation is here available, the triage information, any home meds, and their history is also available here. You'll note at the top that there's these icons, and we can also view the vital signs from here. Any medications that are due, any labs that have been ordered. And I'll click close. I will now navigate back to all beds, and I'll pick a patient with medications so that I can demonstrate additional tabs. We can see here that this patient has medications due, and we know they're overdue because we see the red bar. When we hover, we see what those medications are. I'm now going to click onto the medications for more information. And I'd also like to demonstrate that you can also view the patient summary here. There's multiple ways you can access this information. This patient here has 11 nursing tasks, and when we hover over it, we can see that we have assessments due, and we also have medications due as well, and we have an infusion. Finally, I'll discuss discharging the patient. When a patient leaves the emergency department, the patient's emergency encounter must be completed and the patient's information removed from FirstNet. It's important for the correct patient information to be entered, either by the patient's primary nurse or by a nurse that assists with flow from the department. I'll now demonstrate the discharge process. Right-click on your patient's name and select Discharge Process. The statement of attendance appears, and this is where the doctor will document directly into this section here, and you'll also see that the doctor has entered the working diagnosis for this patient. If the patient is ready to depart, you simply click the pencil to date and time stamp at the current date and time. We can then click on Close. When the patient physically leaves the emergency department, it is up to the patient's primary nurse to move the patients to the exit or departures location on the ED tracking list, and also inform the exit administration officer of the patient's departure and add a comment into the nursing comments with the time and location of discharge. So for example, I would come to my patients, I would click on the icon, and my nursing comment would be discharge home at 1500, or if they were ward awaiting admission, we would type in ward awaiting admission at 1500, for example. We save that information and it now appears on ED Launch Point. The final step is to remove them from the location and move them to exit, and the way that we do that is we click onto their current location and we find exit. Depending on the facility in which you work, it may be listed as exit or it may be listed as departure. Click OK, and this warning appears on the screen that this bed is currently assigned to another patient. There will be multiple patients allocated to exit. We can click Yes. You'll see now that ED Launch Point has updated.